Love you, Charlie. I love you, Charlie, and thank you. Dad, I think, is looking down, smiling, not only on the fact that we're going to do this, but that I'm associated with such wonderful people. And I'm proud to be here with my colleagues and to tell you about how exciting this day is. I've worked 50 years on health care reform, and the release of this discussion draft is the first step towards getting a bill passed this year. What we have come up with is an American solution. Much planning has gone into the discussion drafts that you and the rest of the nation will see today. But now the real work begins, the work of explaining to our colleagues in the Congress and making the proposal available to the American people. We offer greater choice to the American people. People will have the option to choose between plans, to keep that which they have now and to keep their doctor, or to make such changes as they wish as free Americans to do. We will also give the people the choice of a high-quality public health insurance option that will compete fairly and evenly with the private companies, so as to provide a yardstick and a measure for people so that they can know what there is out there that will give them the best choice of health care. On Tuesday, I was a part of a hearing in which Chairman Bart Stupak asked the heads of 3 insurance companies what they would do to stop the terrible practice of rescission, which has left thousands of Americans burdened with costly medical bills despite paying their insurance premiums in the fashion that they are supposed to. And they all said they had no intention of doing that. Rescission is simply where you wait till a guy is sick and then you cancel his policy on him. This is something that's got to stop, along with some of the other abuses, use of non-community rating systems and what they call pre-existing conditions. There will be no rescissions in the public option, and there will be none of the other abuses which we are seeing in the insurance practices that are now offered to the American people. And consumer protections will be established in that option that private companies have so far refused to do. So we're going to create competition, and we're going to create choice, and we're going to see to it that the public option included in this bill will not only see that people are treated fairly and have the option of having the kind of policy that they might want available, public or private, but it will also establish benchmarks regarding fair pricing and drive innovations that will help reduce long-term cost growth. The public option will ensure competition in areas where there are few private plans. The only alternative to this that I see is counting on the insurance companies to fix the problem. Well, they've had 50 years to do it and more, and I can tell you that that's a terrible thought to me. While there may be some differences in opinions on the specifics of the public option, we share the same goal. That is to fix Americans' broken health care system, something which used to be a matter of only humanitarian concern, but now which is a matter of desperate urgency, not just to American businesses who can't afford this anymore, but to the national economy, which is going to go broke doing this. What we're releasing today, I stress, is a discussion draft. And I look forward to working with all parties as we move forward so that we can end up with the best bill possible. And again, I want to repeat how proud I am to be with my colleagues up here. We're going to give the American people what they need, what they deserve, and what they want. A good, practical program of national health care. Thank you.